What is AIDS? HIV stands for Human Immunodeficiency Virus. If left untreated, HIV can lead to the disease of AIDS. Unlike some other viruses, the human body can't get rid of HIV completely. So once you have HIV, you have it for life. HIV attacks the body immune system, especially the CD4 cells, or also known as T cells, which helps the immune system fight off infections. Over time, HIV can destroy so many of these cells that the body can fight off infections and diseases. These carry more infections, such as cancer or many other, and this can lead to your death. Risk factors. 1. Having sex with an infected person of AIDS. 2. Throwing a needle with someone who is infected. This normally happens with people that are in drugs. Being born with it. 4. Drinking breast from an infected woman. This happened in a very young age. 5. Getting a transfusion of infected blood in a hospital when you are in an accident. The symptoms for AIDS are a long list. 1. The rapid weight loss. 2. You have recurring fever. 3. Extreme and unexplained tiredness. 4. Prolonged swelling of the lymph gland in the armpits, groin, or neck. 5. A diarrhea that lasts for more than 1 week. 7. Sore anus, mouth, or genitals. 8. Pneumonia. 9. Red, brown, pink, and purplish brush under the skin or inside the mouth, nose, or eyelids. We can explain that this is very painful. And 10. Memory loss, depression, and other neurological diseases that come with psychological disorders. Preventions. We as adolescents, we have to take insight, like the last slides we have seen, that AIDS is a pretty damaged and painful disease. That's why we have to avoid the risk of having it, even the mere thought of even getting it should be erased from our mind. Here are some examples that you and your partner can avoid this horrible disease. 1. Get tested of HIV with your partner. Have less risky sex. Was risky sex not having condom or not checking with your partner if he has HIV. 3. Treatment. Use a clean and new condom, like I just said. There are medications for the complications. Limit your number of sexual partners. Treatments are made to reduce the HIV don't be a horny teenager as it could be. Please, drugs like stop getting drunk and having diagnosis. 5. Are get tested or treat for STD. 8. Talk to your healthcare provider about pre-exposure prophylaxis, pre-EP. And 9. Please don't make the mistake of injecting drugs. I think this for kids of our age should be pretty obvious. Don't do drugs, and even if you are creative enough to take drugs, just have your own needle. Don't share the needle, please. Preventions. We as adolescents, we have to take insight, like the last slides we have seen, that AIDS is a pretty damaged and painful disease. That's why we have to avoid the risk of having it, even the mere thought of even getting it should be erased from our mind. Here